back with Dr. Ennis, an urgency care doctor, or actually an urgency care doctor with 2 clinics. Dr. Ennis, workman's comp. So, tell me some of the injuries which, which people get a lot there, and then let's pick one and figure out on, how you can help them.
Certainly the most common injury for any worker is a back strain. Probably the second most common would be a shoulder strain. So we see a lot of back injuries and a lot of shoulder injuries. Certainly wrist strains, neck strains would be in line in the same venue.
Like a wrist strain, would that be something, like just say those white collar workers in computer, and they get the what do you call that thing, like the carpal tunnel, that type of stuff. Is that kind of the same thing that would you call a wrist strain, or not really?
Certainly people with wrist strains can develop a carpal tunnel syndrome. And people can have a carpal tunnel syndrome without a wrist strain. And so
is a carpal tunnel syndrome, would that qualify as a workman's comp also?
It may qualify as workers' comp. It may not qualify as workers' comp. A doctor has to take a detailed history and try to determine if there's some evidence that the procedure at work caused this problem. Mm-hmm. And so carpal tunnel syndrome doesn't necessarily have to be work-related.
Okay. All right. So we had back pain, shoulder pain, wrist. What else do we have?
Certainly people can fall down and injure any body part.
Right.
Certainly the toe, the foot, the ankle, the knee, the leg, the hip. Any body part can be injured by way of a slip and fall, or falling off a ladder, or having something fall on you. Such
as the baseball bat from the boss.
I haven't seen any of those, but I saw a gunshot wound one time from a disgruntled patron, and so we treated a gunshot wound to an employee.
That's a workman's comp case. So back pain. Let's go to back pain, since that is a very heavy one, and probably also applies to people who probably don't get it necessarily via workman's comp. It's just back pain seems to be a major problem, one way or the other way. So tell us, are there different type of lower back pain? Let's start with that lower back pain, the bad one, the sciatic pain, that type of stuff, and tell us of what a patient can expect. What are the methods of treatment in your clinic there?
Well, certainly every patient is different, and so a plan of therapy has to be tailored for each patient. Certainly if they have a problem created by an injury at work in which they've lifted something, or they've strained something, or they've fallen down and strained their back, when a doctor examines them, the doctor usually can determine that they have tenderness and muscle spasm of their back. Sometimes that's on both sides of the back. Sometimes it's on one side of the back. Sometimes it's in the lumbar spine only. Sometimes it's in lumbar and thoracic. Sometimes it even includes the neck. If the pain in the lower back goes to the sciatic area, and if the sciatic nerve is irritated for one reason or another, it can be injured with direct trauma, but it also can be injured with a herniated disc. Certainly there are elements of a physical examination that can help the doctor make that judgment. If the patient has reflexes that are equal and strong on both sides, and there are no radicular symptoms, in other words, if the doctor elevates the leg and there's no pain that goes down the leg, then there would be no radicular symptoms. If there's pain that goes down the leg when the leg is elevated, then that causes the doctor to think that there's pressure or damage or injury to the nerve that goes down that leg. And when we see something like that, we certainly like to put the patient on anti-inflammatories. We generally take x-rays of the back, and then if we treat them conservatively for 3 or 4 days or a week, if they're getting better and their symptoms resolve, that's all we do. If their symptoms do not resolve, then we advance to having an MRI done, and then probably having some physical medicine done. After physical medicine and after an MRI, depending on what that shows, we may want to get a surgical consultation if we think that the patient needs a surgical remedy. So there's
what's a physical medicine?
Physical medicine would be related to a physical therapist. Sometimes a chiropractor can do physical medicine, an occupational therapist. So there are 3 branches or disciplines that do physical medicine. Chiropractic does physical medicine, physical therapists do physical medicine, and occupational therapists do physical medicine.
Okay, I see. So basically, it brings me to the question, what are the treatments, so basically you treat the person with physical therapy and with chiropractic, and you do treat the person with inflammatory medicines, and are you giving like, I know some people give, steroids and all kinds of things. Are you first going more towards alternative type of, like non-invasive, let's put it ways? And what can the patient expect there? What are you putting him through? Is he coming once a day to, get put on a stretcher, like on those decompression machines, or you give us a little rundown of what it is you actually. Again, every patient is different, but what are some of the ways and methods you use?
Well, certainly, if the patient has muscle spasm, there are a lot of things that a physical therapist can do to relieve that muscle spasm by way of training the patient to do or to use the back in different ways, in certain ways, to relax those muscles. Other people besides physical therapists can do that too. As I mentioned before, occupational therapists and chiropractors can do that. We don't do any chiropractic manipulation in our firm, and so our firm uses more of the skills of a physical therapist in that venue of treatment to be able to manage the muscle spasm. The other things that can be used to manage muscle spasm include the anti-inflammatories. You can buy anti-inflammatories over the counter without a prescription. There are some stronger anti-inflammatories that a doctor can use, and so we generally use a prescribed anti-inflammatory. Muscle relaxers are very helpful, and sometimes pain medication, analgesics, are helpful. And it all depends on how bad the pain is and what we have to do to relieve that muscle spasm so the patient can begin to relax and that area can begin to heal.
So basically the thing is to get the pain away, and by doing so, usually the muscles or the damaged areas to a very high degree, they start healing again. So
yes.
Is that how it works?
Yes, it's very much how it works. Now, you mentioned alternative medicine. We really do not use alternative medicine in our practice, but nutrition is always important. People that are heavy smokers have a hard time healing. They should quit smoking. If a person has poor nutrition and is a heavy smoker, they don't heal well. And so we direct them to try to solve those problems while their back is healing.
Great. Wonderful. Okay. Anything else you think a patient should know in terms of like a back injury if he has one? Should he kind of like, many patients, many of us people, we drag things out, kind of like, okay, it hurts a little bit, I can stand it, hurts a little more, I can stand it, it will go away. Does things like that, when it comes especially to back injuries, since we talked that now, does that kind of like make things more difficult down the road to cure it? And should a person go a little faster to the doctor, or not really? Kind of like, when it's at the level of you can stand it, to come in, that's just fine, because what's your take on that?
Every person is different. Every person has a pain level that is different. Some people can tolerate a lot of pain. Other people cannot tolerate any pain. Certainly, if you have some back pain that lasts beyond 3 to 4 days, you probably should be seen by a physician. If during that time the pain starts going down your leg, you certainly need to be seen by a physician. If you have started having difficulty producing urine or defecating, you certainly need to see a physician. But if you have a little backache that's getting better on a daily basis, then not seeing a physician is probably not going to interfere with any treatment. And the initial treatment for all back strains involves conservative care. And a patient can really do a lot of that conservative care on their own.
Okay. Wonderful. We'll talk about it. Thank you very much.
Okay.